So, it's bound to be a really exciting video series that I'm entitling Toby Reads to You from Incredibly Boring Regulatory Documents. And this first edition, unfortunately, is really only relevant to MRI providers in the United States. This is CMS, Center for Medicare and Medicaid Services. They're the people who pay for Medicare, Medicaid, and TRICARE patient care. And this is May 15th, 2015. This is what's called an Interpretive Guideline memo or report. So CMS has rules that essentially say, be safe, deliver good care, right? And then periodically they issue these interpretive guideline memos that say, when we say be safe and deliver good care, when we say that generally, when we apply those principles to this particular area of healthcare, it should be understood to mean this. And this 2015 Interpretive Guideline report is specific to radiology. And I've gone through this document, it's 20 pages, something like that, 38 pages. And I've identified the elements. These are requirements for any healthcare provider that gets reimbursed by CMS. Now this is all about everything radiology and nuclear medicine. And so I'm just gonna kind of highlight the sections that can be directly applied to MRI and MRI safety. Hospital must adopt and implement radiologic services, MRI, policies and procedures that provide safety for affected patients, hospital personnel, and which are consistent with accepted professional standards for radiologic services, MRI services. You must provide patient care in compliance with accepted and recognized guidelines and standards. What are they? They go on to say professionally approved standards also include recommendations or guidelines promulgated by expert governmental agencies, as well as those issued by nationally recognized professional organizations. And they list several of them. Chief in their list, second in their list, is the American College of Radiology. As we know, the American College of Radiology has released their previous guidelines, MRI guidelines for safe MR services, and now the manual on MR safety. So we have from ACR, which is specifically identified, we have practice guidelines specific to MRI safety. So policies and procedures should follow existing identified standards and best practices, and the most applicable standard for MRI safety would be that from the ACR. It goes on to say that you have to have written policies and procedures, and that these need to be reviewed and periodically updated. That you need to have policies and procedures not only for the ionizing stuff, but also for the non-ionizing stuff, like MRI. If your facility doesn't have MRI specific policies and procedures, and you participate in Medicare, Medicaid, you are not compliant with the CMS conditions of participation as defined by this 2015 memo. Additionally, and these statements are broadly written to apply to all of radiology, but I'm going to essentially replace radiologic services with MRI. Training required by personnel permitted to enter areas where MRI services are provided. Now, we have spatial definitions within the MRI suite, right? We have zones 2, 3, 4 are parts of the MRI suite. And really zones 3 and 4 are the restricted access portions because there are specific hazards in MRI. So slightly reworking this, training required by personnel permitted to enter zones 3 and 4 or 4, you have to provide MRI safety training per CMS for personnel, clinical or support personnel who, as a function of their job, enter zone 3 and zone 4. If you don't have MRI safety training requirements for anesthesia, respiratory, ICU nursing, cardiology, anybody who is coming to tend to a patient, if their job duties bring them into Zone 3 or Zone 4, and you do not provide them with specific MRI safety training, in my opinion, you're not meeting the requirements of CMS. There's a second training criteria. Training and, as applicable, qualifications required for personnel who perform MRI, it says diagnostic imaging, who perform MRI studies using MRI equipment. This includes proper operation of the equipment per manufacturer's instruction and hospital policy. So we have one tier of safety training required of anybody whose job duties bring them into Zone 3 or Zone 4. By the way, this would include your radiologist. Then we have a second tier of training and competency and qualification for the operators of the MR equipment. Most accrediting organizations that have MRI safety training requirements, if they are actually requirements, only require it for the operator, and there are no explicit MRI safety training requirements for other people, other staff who have to work in the MRI environment. And as I read the CMS conditions of participation through this interpretive guideline memo, that don't cut it. So simply complying with your accreditation, as I read this, does not mean that you are fully compliant with the required conditions of participation for CMS. It also indicates that surveyors are supposed to look for patient preparation as one of the indications that facilities are actually adhering to proper safety protocols. In MRI, patient preparation takes many different forms. That's effective patient screening, changing and gowning, or minimally getting rid of metallic and ferromagnetic materials, components, clothing items, pocket stuff that they bring with them. And there are a number of different elements associated with the what the surveyors are supposed to look for. Surveyors are supposed to identify which standards are being used to define policies and procedures and operational protocols. They are supposed to look to make sure that your safety protocols are reviewed and updated regularly. And if you're using the same safety training, safety protocols that you developed 10 years ago and nobody's looked at them or approved them or recognized a need for any change since then, again, the way that I read this, you are not complying. The staff needs to be familiar with policies and procedures. Verification of training at appropriate intervals. And this doesn't say, but if you look at the ACR manual, you look at other elements, Joint Commission training indicates annual. I think that that's a reasonable minimum. Verify that Radiologic service staff know how to respond to adverse events. I would say if you've got people serving clinical care functions, your anesthesia, your respiratory, your cardiac, your ICU, if they're in the MRI suite, they really ought to understand their role or their absence of a role in an emergent code situation. And then this one I think is really interesting. The radiologist who supervises the radiologic service, the surveyors are supposed to make sure that the radiologist monitors quality and safety of the service. How many of you have sites where the radiologist actively, periodically reviews the safety of the service? We've seen posts on the group about radiologists who essentially throw their hands up and say, hey, look, my job is to read, I'm not responsible for the safety of the service. Guess what? CMS disagrees with you pretty directly. Anyway, so that is the Toby Reads a Boring Regulatory Document. For those of you who are interested in seeing this, this is available online. I'm just going to hold it up if you want to pause and grab the title of this. I hope this is helpful. Again, this is just CMS, which is the government payer in the United States for Medicare and Medicaid. But I think this is really interesting, particularly when we compare what CMS apparently thinks is or ought to be the minimums. We compare and contrast that against what existing facilities, have in place, and what existing accrediting organizations, who ostensibly are there for quality and safety, what their minimum requirements are. Because to me, they don't appear to meet the minimum requirements for CMS participation. Anyway, hope this was interesting to you, and I look forward to your thoughts and comments below. Thanks.